So, can't sleep, clowns will eat me, so I'm going to just tell you guys another story uh, in the realm of my adventures in aberrant psychology and probably rename the other stories I've told you guys. Make this a series, you know. So this will be the third time I've told a story, or stories, as it will be this time. So yeah, last night wasn't hard. There was a Christmas party, and a lot of prime rib was handed out to people, and so I really enjoyed that. But I was put one on one with a special case of an old lady who, again, I wasn't sure exactly why I was there watching her one on one, but she did have some issues. But she slept most of my time with her. Just sleeping, 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 and here I am, watching, checking off things on a behavioral chart. You know, room, sleeping, my initials, room, sleeping, my initials, room, sleeping, my initials, every 15 minutes. But when she was up, she, like many other old people, was suckered in by my question of, is your son a good son? You know, because everyone who's that old wants to tell me about their kids, you know, and that's something that they can go on forever about. But it's hard to really judge whether or not a person has mental issues when they're talking about something that they're so familiar with. Because they can just rattle off these stories that are really ingrained in them. In order to get a really good picture of someone's real mental state, you have to ask them more not about them questions. Like who the president is, what day is it, yada yada. And after about an hour of her telling me about how good her son was, she wanted to call him, you know, and so I asked a nurse if we could have the nurse's phone, and there were some phone numbers written down on a little post-it on her end table. And she picked up the post-it, and she said, okay, the number is 9... And she looked like she was actually starting to say H, right? But as I looked at the post-it, it was upside down. And the last two numbers of the number she was trying to read were 4-6. But she read the number upside down, and she was looking at that 4, and it looked like an H. And I waited there for a second to see if she would get it herself, that her own son's name was upside down on the post-it. You know? She just looked at me and said, "You do it." And, you know, she was a fall risk, mostly because of the strong medication they were giving her. She was okay during the times when the medication wasn't hitting her. But one strange thing she did right after her call was she walked over to the sink, and she had an assortment of makeup for herself. And she was putting her lipstick on, just like a normal person, around her lips. And then, like Stallone in Rambo or Schwarzenegger in Predator, she takes the lipstick and goes like this, right across her face. And then like this. And I'm like, oh shit. What's going on now? You know, this is kind of weird. So then she caps the lipstick with stripes on her face, like a football player, you know, or a soldier trying to do camouflage. She caps the lipstick, but then she looks up in the mirror and she takes her hands and rubs it in to her cheeks. And then it made sense. She was doing like a poor woman's rouge, a blush, you know? And I was thinking to myself, this job is so grinding on me that it's worse that it makes sense, you know? Because now I'm thinking that she's putting on makeup because there's a guy watching her in the room. She had complimented my hair, which is strange because I need a haircut, but it it would have been more settling to me if she had just left it as stripes on her face. I would have been like, yeah, well, she doesn't make sense. But she did, in a way, make sense. The previous night, I was with a patient who also slept most of the time I was with him, but he had a better reason. He had, in a suicide attempt, downed 4,000 milligrams of Seroquel, which, for those of you who don't know what it does, it's normally not a sleeping pill. It's more of a anti-anxiety thing. You probably could suss that out from the name, but it normally comes in 25 milligram pills. So I'm guessing he took over 100 pills of it. Why they would give anyone 100 pills of something that they might be able to kill themselves with, I don't know. But that's what they did. So, when I was introduced to him, he seemed happy to see me, but shortly thereafter he fell asleep. 2 hours later, he wakes up, and I have about 5 minutes of conversation with him. And he falls asleep again. In mid-conversation. So, 2 hours later, he wakes up again, and I tell him, you fell asleep right in the middle of a sentence last time. And he starts apologizing. Like, oh, I'm sorry, I don't mean to be rude, I just, I took all those pills, and I can't control it. He had pressure cuffs that were constricting his legs to keep the blood flow going, because I suppose he was going to be there for a very long time as the Seroquel wore out of his body. But the acute reasons that he wanted to leave this world were many deaths in his family, which, this person dies, this person dies, this person dies, now I want to die. Doesn't make sense to me, but it makes sense to some people. And then he got one letter from a family member, trying to make this as vague as possible so no one identifies him. But he got a letter from a family member saying that they were upset that he didn't show enough sadness at the funerals for all of his other family members. And so that family member didn't want to see him again because he was an asshole. He wasn't sad enough. And that made him want to kill himself. The night before that, I had, yet again, a sleeper. Slept most of the way through the day. He was a bricklayer, and he had a motorcycle accident, and he had pins in his leg and in his arm. This was like an old motorcycle accident, but he had pins in his legs and his arm, and he couldn't do bricklaying, something that he had done for like 30 years. And so he was out of a job, and he had spent most of his savings just on medical bills, and he didn't see a way out of more and more medical bills, and he was in a lot of pain, and part of his face was paralyzed still, and it felt weird to him, and he just was feeling like ending his life, so he turned himself into the ER. And when I got to him, he was agitated because he had been there for a day and a half and had not seen an evaluator, been placed or anything, you know. I think mostly because of his agitation when he first got there. He got restrained for a bit because things weren't going fast. That's why he got agitated. And it's one of those cruel cycles of, the service that happens in the hospital doesn't meet the patient's needs or expectations, which creates different problems. And once somebody's upset that they're not getting attention, if they get violent or aggressive and they get restrained, that actually puts a different time clock on other services they can get. For instance, you can't have a psych evaluation within a certain number of hours after being restrained, because they just consider it a state of mind where you're agitated by having been restrained. It's one of those. There are certain medications that you also can't be given and then get a proper evaluation. So, it causes other problems because they get more agitated because the treatment that they get prevents the other treatment. So 3 sleepers in a row for me on 3 separate days. But before that, I had a patient. This was Sunday night. She had meth psychosis. And I had never experienced it quite that way, because there's meth that starts the tics and the jitters. But this girl had so much meth in her system that she was hallucinating, and anyone with a uniform, any hospital uniform, that walked into her room would set her off, and she would start screaming that the FBI had raped her, police had forced her to take drugs and raped her. Why do judges and lawyers get to smoke crack and sell women? Where is the justice for everyone? And she was screaming it so loud the whole hospital could hear. I'm like, ugh, nobody go in there, just leave her alone. You tuck someone in, you get them ice water, you get them a blanket, you get them, a fluffier pillow and everything, you get them all the way calmed down. And somebody has to go in and try to take blood. And they've got their badge showing, their badge that they operate all the doors with. They'll have their stack of badges all on one ring, and they'll be right there, and that just scares the piss out of her. And then I have to deal with it for another 10 minutes. But as I was watching this lady, who, she would be, up to that point, the worst patient that anyone in the facility had. I was on the worst patient. I saw an even worse patient pass by me as my coworker, Carlos, was assigned to a guy who had one leg and was found on a public transit bus, the company's RTD, and he had been on the bus drunk, and he's homeless, so he has a lot of baggage with him. And he was so drunk on the bus, on his wheelchair, that he shit himself. Now, there's a horrible turfing thing with RTD buses and the homeless shelters in Denver, where the shelters are giving out month-long bus passes, which would help a homeless person get to a job or something, But it also helps them inadvertently, or maybe even on purpose. It helps them to go have a night of drinking and then have some place to stay because they get on the bus. And then if they get on the right bus, the one that goes up and down Colfax, the longest street in America, they can get on a ride that lasts 5 or 6 hours up and down it, you know. And then the bus has a policy now that they can only ride one loop, and then they'll get kicked off. But what does that do? They ride again in 15 minutes by just staying at that bus stop. But this guy, he had to be removed before his one loop because he shit himself. And when he made it to the hospital, everything below his nipples was covered in diarrhea. His wheelchair, his baggage, his all of his stuff was just smothered and covered in diarrhea. And as I'm watching my meth psychosis lady, I see paraded down the hallway him in a pediatric bed because he wasn't that large because he was one-legged. 5 nurses that were all gowned up as if Ebola had come to our hospital. Carlos, who was carrying biohazard bags filled with his stuff, red, bright biohazard bags. And then a nurse pushing a wheelchair, which had been covered in biohazard bags that were, hung over it and taped to the side and everything. Basically, it was one big, like, Christmas present-like biohazard wheelchair. And this guy had a stink radius of about 20 feet. So it got me. Got me good. They put him in a bed. They let him sober up. And the horrible part about it is we know that he got on the bus because he wants to drink. Right? And so he got on the bus not because he had a place to go, but because it's shelter for the night. And rather than going to a shelter, and trying to lift himself up out of whatever situation he's in, he'd rather drink and get on the bus. But then when he gets to the hospital, he treats it, when he sobers up a little, he treats it like it's a 4-star hotel with, room service. He's demanding. He wants his sandwich. He wants a soda. He wants people to get out of his room. He doesn't want to give blood tests or anything. He knows his rights. Rah. So they just let him sleep it off. And afterwards, they put him in a room where normally they would kick someone out once they're sober. Once they're under the legal limit, they would kick them out of the hospital. But this particular guy, nobody wanted to clean any of his stuff. It remained in biohazard bags for him. And they set him in a room on the side. And they called a social worker to try to get him a new set of clothes. Maybe do something about his wheelchair. But the conversation between the doctor and nurse that I overheard, it ended with, if we can do that one little step above, we should do that, And then the doctor turns to the nurse and he says, another life saved, And it's become like a joke meme in the hospital, in the patients that I have to deal with. Another life saved. You do what you can, and you're not saving anyone's life, really. No one's having any epiphanies. No one's changing their behaviors. It's just acute, the worst night of their life care. And you never get any closure in it. You never get to see anyone's life saved, but, you get someone a cup of coffee and they calm down and go to sleep, and you're like, yes, another life saved. Until the next installment.